Welcome back to part 2 of our video. During your 3 years at Upstate Family Medicine Residency Program, you will have multiple opportunities to pursue a career that can be shaped around your future interests. We offer 5 4-week elective blocks during your PGY 2 and 3 years. In addition, there are multiple areas of concentration where our faculty spend their time that you can use during these electives. The next series of slides highlights some of these interests, not all inclusive, and areas of expertise. Again, welcome back to this video, and I look forward to sharing these next slides. One of the outstanding and highly desired components of our program is its emphasis on integrative care and wellness. Dr. Nanavati, who is pictured in the lower left-hand corner of this slide, has currently accepted the position of Assistant Dean of Wellness for our Upstate University campus, and for the last several years has been working to integrate wellness and integrative medicine into our medical school and residency curriculums. One of his sayings is that in order to take excellent care of our patients, we must take excellent care of ourselves. In other words, to walk the walk. Further, he states, it's about teaching people to be well even before prevention. All of these different areas on this slide are discussed and put into practice with our residents. Mindfulness and meditation is a weekly practice throughout the Upstate campus. It's been termed Tranquility Tuesdays. Our goal here is to help you optimize your quality of life and to become the best version of yourself. We want to teach you this so you can model this for your patients. This slide is from Dr. Sinkata, who is our medical director for the Continuity Clinic. He brings a wealth of knowledge and experience from over 25 years of being a medical director of a large network of offices in Pennsylvania. He is energetic, innovative, and very progressive in building a best practice for our residents. So what does this have to do with cycling, you may ask? Well, Dr. Sinkata is an avid cyclist, and every year he fundraises for a 100-mile trek to and around Lake Tahoe. So he may be advocating for our residents to exercise. He also invites them often to cycle with him. But my take on this slide is about life's journey, your journey through residency and beyond. There will be some flat areas, but there will also be many hills. And if you bike out in the country around Syracuse, there's a lot of hills. So it's our job to facilitate and support and to train our residents to get over these hills. And as we do this together, we will become stronger citizens and physicians to the communities we serve. So, Dr. Sinkata, this, I know, is your curriculum for residency training. Dr. Finn is our family medicine student advisor who works tirelessly to promote family medicine in our medical school. She also precepts our residents in the Continuity Clinic. The message here is that she wants our residents to know there is ample opportunity for involvement with medical education to engage and connect to our medical students at Upstate Medical Center. The FMSO, or the Family Medicine Student Organization, coordinates numerous activities that can be, and many times are, led by family medicine residents. It's a matter of interest and willingness to get involved. Currently, our residents are teaching GYN exams to medical students through the Practice of Medicine course that's required for all medical students. And there are also other opportunities for residents to teach our students. You'll become a mentor and advisor to many and share with them about residency life, especially as you interact with them on your rotations. Lastly, and I cannot overestimate that you will be a part of recruiting our next PGY1 class. As family medicine residents, you share our passion for family medicine and are an advocate for primary care. It is in our minds and our hearts, and I know that you will be sharing that with medical students along the way. Dr. Mindy Graywell is our site coordinator at the VA Medical Center. She has spent many years working on developing a women's health center there, and in addition, she is black belted in lean management and board certified in integrative medicine. The Syracuse VA Medical Center is now the country's leader in the whole health system. This work focuses on intersecting patient care with community resources to produce a personal health plan that is depicted in the circle on this slide. It combines three main elements. One, empowerment of the patient, and this is through partnering with the Veteran Administration, equipping them for wellness and self-care, and thirdly, whole health clinical care, both on the inpatient setting and the outpatient settings. The system may actually exemplify healthcare systems in the future. The VA Medical Center also has a lot of other opportunities, including quality improvement, home-based primary care where patients are treated at home rather than in the clinic, and lean management. The VA Medical Center was doing telemedicine well before COVID, and at that time was leading the charge in this area. Your longitudinal geriatrics and nursing home experience will be at the Community Living Center, which is home to many veterans with chronic illness and unable to live independently. Lastly, I'll mention POCUS, in that currently we are creating a POCUS curriculum utilizing our fellowship-trained emergency room physicians, and we'll offer it to all of our residents before graduating. POCUS stands for Point of Care Ultrasound Training. The Certificate of Advanced Study in Public Health, or CASPA, is an option for our residents who are interested in furthering their public health interests. It is a facilitated admission process, and tuition is fully waived. Each resident must fill out an application the summer of their PGY1 year and then receive a letter of support from their program director, which is me. They can start this program at any time, but it takes 2.5 years to complete if you're doing it during the residency. The program runs by semester, like most postgraduate studies, and you will take 2 courses per year. The courses will run typically for 3 hours, once per week. You will complete 5 courses as listed here, and you can do this in any order. These courses can be used for completion of an MPH later on if so desired. Myself and Dr. Zachary are very passionate about maternity care. Dr. Zachary has joined us after completing his fellowship in OB while he was in Texas. He brings a wealth of knowledge and skill that allows our residents to take advantage of full scope maternity care, including assisting with cesarean sections. I have an interest in sports medicine and currently am team physician for the AHL Syracuse Crunch, affiliate to the NHL Stanley Cup champion Tampa Bay Lightning. I also am school physician for the ESM Central School District. Residents are encouraged to join me and also will have a 4-week rotation in sports medicine during their PG3 year. There will also be a sports medicine fellowship starting soon through our emergency department for any resident who wishes to apply. Lastly, once a year, I go to Central America on mission work. It is an opportunity for 1 or 2 residents to experience practicing medicine in some of the poorest settings imaginable. We will bring a portable ultrasound, and last year we were able to diagnose twins in a woman who was not receiving any prenatal care. This diagnosis was instrumental in getting her into a local physician, as it turned out. So in conclusion, no matter what, upon graduating from this family medicine residency program, you will be an excellent clinician. But in addition, we have built multiple avenues for you to explore opportunities to cultivate your passion for career development. Again, we are not a cookie cutter program. You're not spending endless nights on call because the hospital depends solely on your services and work. We will assist you in finding mentors that are working with you and helping you to plan and shape your educational experience for your personal and career development. And we are not doing this alone. We are not creating this excellence. We are partnering with existing powerhouses and faculty who have already demonstrated excellence and expertise in these areas. We are a new program, but we are also an old program. It is about collaboration with our many colleagues at Upstate and the VA Medical Center, in addition to community outreach. So here you are. What pathway do you want to take, and how will you get to your end? We will make sure you get there. These are like the turrets in our residency building. Let's build them together. Thank you so much for your attention. Please be safe and well.